The Wangkatjungka Community Clinic is part of an upgrade of around 8 Aboriginal clinics across the Kimberley. It's a part of a $22 million program, and in Wangkatjungka we're spending $3.6 million to expand the clinic and to create a fit-for-purpose and culturally secure centre to deliver health services from that community.
And that clinic is now open. Can you tell us a little bit about the services that can be provided now to the people of Wangkatjungka and surrounding communities through that new clinic?
Yeah, sure. Look, I mean, what we are able to do with the advances of technology is to provide more and more sophisticated services from these sort of clinics. So it's important that we can upgrade the technology at them, but also make sure that they provide a modern setting to provide health care. So at this clinic, we have its own pathology space, 3 consult rooms, a family group room so that we can have conferences and discussions with families, and also separate waiting areas for men and women so that people feel secure when they go to the facility and can get their care in a proper environment. Now, obviously, what we need to do is to make sure that we can have the staff in that clinic. So it'll be open from 10 to 2, and we'll have a registered nurse providing acute and emergency treatment, along with regular appointments around maternal health, child health, immunisation, sexual and reproductive health, but also monitoring chronic conditions and other services. So it's going to provide a comprehensive range of services for the people in the community. Be able to provide them, but with visiting clinicians, obviously, from Fitzroy Crossing as part of ongoing clinics.
Recently, Nookamba Clinic went from being a similar clinic to Wangkatjungka, where nurses and doctors and healthcare professionals would fly in and then fly out on particular clinic days. Nookamba's changed now to being a permanent clinic where nurses are permanently located out at Nookamba. Is there any room in the future for Wangkatjungka to be moving towards a similar setup?
Obviously, what we're looking to do is to see what opportunities advances in technology provide us to provide more and more services at that clinic. So by having a permanent-based child and adolescent mental health and drug and alcohol advisor, as well as 2 Aboriginal health workers at that clinic, we have the opportunity to provide further services. But I'm really interested to see how we can utilise telehealth and other technology to continue to provide more and more services in our rural and regional settings.
I'm speaking with